Welcome to Health Stealth Radio, where we move away from the mundane to gather insights from the shadows of enterprise and patient cybersecurity. Yes, we surely believe that traditional themes like endpoint software and zero trust are critical, but given massive advances in AI, remote and wearable device hacking, and data hostage negotiators, there's a much darker side to cybersecurity, and not everyone is quite willing to talk about it in public. Health Stealth Radio will thrive on these topics and encourage fireside spats to debate them. Here's your host, Frank Cutitta.
Welcome to Health Stealth Radio. Tonight we have Lukasz Kowalczyk. Health Stealth Radio, brought to you and syndicated by Healthcare Now Radio. I've been looking forward to getting together with Lukasz. We had a fantastic intro conversation. We went all over. We solved, I'd say, 3/4 of the problems in healthcare in the 45 minutes that we spoke. But now I get a chance to talk to him about some specific issues. Without further ado, I'd first like to introduce you and have you talk a little bit about your medical career and the entrepreneur side of you that is with CEO of Soothien. So without further ado, Lukasz.
Well, Frank, thank you so much. I really appreciate that intro. Yeah, and I'm pretty sure we solved all the problems, and we'll discuss them all today. But like you said, I'm Lukasz Kowalczyk. I am a practicing gastroenterologist, but I've also been fortunate enough to work in the health tech space. In 2018, I decided to take on the task of building out a surgical scheduling automation platform that was focused in the GI space. And I was fortunate enough to be able to build that out, have that company acquired, have the experience of understanding what it takes to build a healthcare product for enterprise from 0 to 1, and really see the complexities around that in forming a business, and then subsequently moving on to my career of being able to help consult for companies, for startups, and really move into consulting with my company, Soothien Healthcare Innovations, where we really focus on really helping companies see their business as the product and not their product as their business. We really want them to see their entire business holistically, because it's really the business working holistically that's going to help drive value for their customers across 3 core competencies, both the tech side, the clinical side, and then understanding the ROI side of their products as well, which, as you know, in healthcare can be very complicated.
Yeah, I did sort of an ambush question off to the side. Being a physician and then launching a business as an entrepreneur, what were some of the reality checks that you went through in starting up a business as opposed to healing people?
That's right. Yeah. I think that, well, so number one, I have this affliction of chronic dissatisfaction. So
I'm a fellow participant. Yep.
Yes. And so I was motivated to really start that. I think that it was good. It was both good and bad that I didn't know what I didn't know, essentially, of trying to break into health tech, in that healthcare is a labyrinth, right? It is opaque, and it's hard to understand the entry points and the customers. And so I think that that was one of the biggest challenges, is really understanding the entire marketplace and the way to go to market. I was fortunate enough that I had a great network. I was able to find validation and value quickly, and that's what allowed me to keep going. So I think the key was that I was able to find validation very quickly and find customers that were willing to partner with me, and especially over COVID, because this was a product that was both a digital product that interacted with patients and allowed for scheduling of patients remotely as well. And so there was a lot of demand for these types of products, especially over COVID. So I think I would have had a much harder time had it not been around COVID, and there was a lot of companies looking for these types of digital solutions that focus both on the back-end operations, but also engaging with patients. So it was definitely a timing issue, but it was, if I do it over again, I definitely do a lot more research moving forward.
I understand that. So this is a healthcare conference and convention season. Goes into March with the HIMSS conference. I know that you had the opportunity to walk the floors of health, HLTH Health.
Yes.
I'm always interested in in the land of hype and bright shiny objects. What were some of your observations there? What were some of the themes that you said? Well, I would expect that people are going to say this over and over again. And what were some of the new themes that came up that actually seemed to have credibility and legs to them?
So yeah, I think that this is really an emerging field right now still, because I think that every large healthcare company or every large tech company had some sort of healthcare offering, right? And because all the big tech companies have made tremendous investments in AI, and so that was really a dominant theme across the board. And I think where a lot of healthcare enterprises have started to see that they're making investments, and it's the time for the return on investment, that the AI has not been a turnkey solution. And I think that a lot of what I saw at health was a lot of focused success stories around where data was readily accessible. So around like radiology products, and around pathology products, where the data is very well structured and accessible. So you can build good AI products around that because the access to data is very accessible. Where I think there's going to be a little bit more question is in the field of agentic AI right now. I think that there was a lot of talk about AI agents, but AI agents really ramp up the level of complexity, and AI agents occur across the spectrum because ideally we'd love to be able to deploy an AI agent, deploy it across a workflow, learn across a workflow, and execute a task without human intervention.
So just to break in a second, just for the purposes of a diverse audience, everybody knows about AI at cocktail parties and can talk fluently about it. But then you get into something like agentic AI, or I know it's gone from robotic process automation to agentic process automation. So there are actually various layers of that. Can you give an example what would be agentic as opposed to robotic?
Yes. So with robotic process automation, it is very much like you have to define the process very clearly, and you have to show like the button click goes here, the button click goes here. You need to pull this file in,
right? And repetitive tasks largely too.
Yes, very repetitive tasks. Where with AI agents occur on a much broader spectrum as well. Like you could just use a model to have a phone conversation and not do a lot of and not do too much automation, pointing and clicking, versus an AI agent that works across an entire work across an entire clinical workflow. And as it's doing that workflow, let's say that you wanted to fully automate the scheduling of a patient across all of your systems, right? And that you deploy it in your back end, and it works with maybe your scheduling system and your electronic health record. And it starts to also learn how to do this autonomously. Like you give it the task, and it starts to learn that task autonomously on its own without too much supervision, right? Or any supervision. That's kind of the ideal of these types of systems, is that you kind of feed it some information and it starts to do the task on its own because it starts to learn and understand that. Maybe you give it a little supervision initially, but then it starts doing the task, essentially executing it like a human, like let's say it can upload like pathology reports and generate the letter, those types of large scale workflows. And so that's kind of the promise of AI agents. That's kind of what a lot of the talk has been about, but you can see the complexity involved in that type of a workflow.
Oh, especially when the workflow is, from admissions to discharge and all the other real medical stuff that goes in between. I'm sure just like robotic process automation, what I'm seeing, and we just had our Chime Fall Forum, we had 1,100 of the top IT leaders in healthcare in the world come in last week. I mean, there's still this natural anxiety that it's okay, robotic process automation. We want to get rid of all the paperwork stuff, all the billing stuff, all the reimbursement stuff. We'd like to automate that. Then as it starts getting a little bit closer to the patient, clinical decision support, it's like, oh, I'm starting to get a little bit of heartburn here. So when you talk about the full continuum, I mean, obviously parts of that are related to very structured things. It's not a lot of decision making. It's that I'm going to pair this with this, with this, with this, with this, and then you're discharged. Are you finding that people are still getting heartburn or getting less heartburn about the stuff in the middle where you're giving advice to clients or you're giving clinical support? Is that still somewhat of a danger zone?
There is absolutely correct. I mean, I think that is the big hesitancy across all enterprise healthcare systems. And this is why I realize, me as a clinician, my job is safe, because I am the bearer of responsibility of decisions.
You are the AI. Yeah.
I am the AI, right? Like I am. I have years of training, certifications, and malpractice insurance that provides me as a source of liability in these decision making capacities. And I think that that's where a lot of enterprise right now is really concerned. And so the use cases that I have been seeing in consulting as well is that it is very, very focused operational use cases with minimal clinical decision making. I think that you can. There's great opportunities in intake, in kind of low risk, low level operations. So answering a phone call, and that's also not just on the enterprise side, but also on the patient side. That's where you see a lot of it's on both sides of the equation. It's like, as you start getting closer to actually making decisions of consequence, that's where people start feeling less and less confident in the AI, both enterprise and on patient side. That's where they want the doctor brought in. That's where they want the human interaction, and basically the confidence to know, like, hey, I am talking with a person that's been vetted, has the credibility, and I don't think that they feel that with AI. But where a lot of these processes are excelling, or where enterprises are dipping their toe into the water, is around like scheduling or reminders, or where there's a very consistent set of questions that can be asked, and there's limited damage that can occur from misinterpretation, essentially.
So the other arms race, and you mentioned the patient, is obviously there's an AI arms race related to cybersecurity because the bad guys are getting it and using it. I would argue that there's the arms race between clinical decisions and patient content and the battle with health literacy as a result of generative AI that patients are using. So how it's sort of interesting that we have to find a way, just like with cybersecurity, we have to find a way to battle bad information that's coming up on Gen AI, and to become the trusted source of knowledge on Gen AI too, to make sure that if they are going to use it, which they are, and they already are, they're using it in a way where they're able to decipher what might be true or what might be false. That was done during COVID. That was done largely with humans guiding it, but now we have algorithms guiding that kind of discussion. So really another patient experience perspective of this, in addition to the way that doctors are using it to communicate with patients for clinical support.
Yeah, I think that you have hit the nail on the head, is that like no other industry, maybe outside of finance, that trust is the key element. And I think it's important for us to take a step back, right? I can walk into a patient room, they have never met me, and they're going to start telling me very intimate details about their life. I may have to do some very embarrassing things to them in the course of an exam, right? And that trust is inherently baked in. And I think that, so that's number one. And we have to make sure that trust doesn't decrease. And there was recently some data released from Ipsos that really showed that trust in clinicians over 5 years has actually declined. We're still clinicians are still the highest rated, along with nurses, still the highest rated profession in trust, but that's slipped a little bit over the course of 5 years by about 5 percentage points. And so I think that we need to be careful that we don't get on a slippery slope with AI, and that we really think about how to nurture trust, especially around like when patients start interacting with AI, that they know that they're interacting with AI. because we know that patients then have a little bit of a different attitude and they want that transparency.
So how much?
around it.
How do you? That's interesting because I hear that a lot, and there seems to be, one of the questions I had is what are some of the great debates that you're hearing out there in medicine that people say, yeah, I'm going this way, we're going this way between doctors, intelligent, reasonably minded people still debating.
Yeah.
There is the question of how much or how you go about telling patients that you're using AI. That some of it might be fantastic, use it as much as you can. Others might be, oh my God, I heard about it hallucinating and wanting to run away with my wife. So you have both sides of it, and it's sort of interesting. At what point, everybody's saying at some point AI is going to be like oxygen. The best thing about some of these innovations is that you don't even know that they're there. I think we're at the point right now of wonder where people wonder whether it's there. And doctors are arguing with the fact, do I have to tell them every time AI is being used? I don't mind telling them about their billing or about their scheduling or about their reimbursement. But I get worried about it if I'm telling you I'm going to have AI look at this arthroplasty on your knee. Where's the balancing act for that?
Yeah, I totally agree with you. So these are great questions. I am certainly not in the compliance and legal department around this.
Thank God.
But yeah, right. But I will say in the discussions in health systems, they just take it off the table. They just say, hey, this is new technology, and I think it's like the more direct the interaction is with the patient, the more direct that that the systems want to make it explicit that you're not talking with a human, you're talking with a
bot,
a digital system, essentially, right? When it's not obvious. And a couple of panels that I've been on at other conferences where I kind of brought up, it's probably a good idea not to catfish your patients. Right.
Yeah.
You don't want to catfish them, especially early on, because as this gets more accepted and more ubiquitous, this will probably go away. But in healthcare, again, where the trust factor is such a big deal, I think that is, I think it's probably better initially to be over reliant. Now, even for me, it became awkward to disclose that we're using AI is in like AI assisted colonoscopy, right?
Mm-hmm.
Like, I was like, do I need to tell the patient? And I told the patient, they're like, okay, I don't care. It's not a big deal for them when I was using the AI to help me detect more polyps. And so, in those situations, like the patient really doesn't care about it.
Right.
In that way, because they don't have a direct interaction and sense that, like this AI has some sort of impact. They're just like, it's a tool, you've edited it, I trust you, go ahead and use it. Right. So in those situations, I don't think it makes sense to, that we have to keep it's like oversharing, it's oversharing.
Do you feel that when you used it, I've interviewed a radiologist recently, that there's part of it that it gives me a level of assurance that my work is more accurate. Yeah. But in relationship to the workflow for themselves, they said it doesn't eliminate anything. It actually adds another layer that I would normally analyze it as a human. Now I have to analyze it as a human and make sure that AI is not giving me a false positive or negative.
Yes. So this is the biggest conundrum here, right? In my experience, so I think AI assisted colonoscopy is like the perfect blend because I don't have to go and recheck anything, right? Yep. Because I can do the verification in real time. Mm-hmm. And so when I'm done with my procedure, I get the best of both worlds. I know that, I had a backup that checked me, and I don't have to re-verify everything, right? Mm-hmm. So it doesn't add a whole lot of time, and I get the backup. So that's great. Those two things occur at the same time. Mm-hmm. Doesn't require any additional work. But that's the big problem in these systems is that where you have to, at the end of the day, you're taking on the liability as the clinician, as the decider about the validity of the information. And I think that when we've seen, like, for instance, in response to patient messages, you still have to go through and read that information rather than construct it yourself. So where's the add-on? The add-on value could be, and nurses really like this, right? Over the course of, if you think about it, over the course of many, many messages where you have to have an empathetic response and compassion fatigue, I think that's where it works. But at the end of the day, there's no easy answer around this. And this is what clinicians have to understand in terms of the upskilling, is that you have to understand that this is not like a crock pot, set and forget it. It actually requires more interaction. It requires
Right.
more proactivity on our parts, not less. And I think that's the key differentiator here in interacting with this technology. It's much more relational
Mhm.
than other forms of technology.
So it gives you the relationship, more of time for the relationship with the patient, but there's the illusion that pajama time is not going to go away anytime sooner. I mean, obviously, ambient helps with that. I don't know if are you using ambient in your practice?
So I've had the opportunity to get hands-on with ambient, but we haven't deployed it specifically in our clinic. I think there's more than enough data to say that yes, ambient is saving pajama time
Mhm.
for sure, right?
Yep.
Like I mean
I
that
agree.
it's there's no question. I think that is a set story. But I think in the scenarios that you're talking about, why does ambient work in the sense of saving time? Because you're doing a lot of the work, and there's a relative range of possibility
Mhm.
around what the output could be for that specific scenario. And that's where generative AI, I think, excels, when you have a wide range of possibility on the output that's acceptable,
Mhm.
essentially, right? Versus if you're moving into radiology and a specific clinical decision, the more focal the output becomes around a prediction, I
Mhm.
think that's where you have to be more vigilant at that point. Like you have to be more vigilant as a system
Absolutely.
and as a clinician. And that's the key distinction there for me is like AI is great at differential diagnosis, at broad ranges of answers to help me access the world of knowledge and to help me then get to a set of decisions versus a very specific, hey, this is a lacunar infarct that you're missing, and you got to check this,
Right.
right? I think those are two different workflows and scenarios, and that also points to the fact of what's your use case for the AI to extract
Mhm.
the value.
So the other part of it, and you had mentioned it. I mean, there's this training aspect to this. I mean, radiologists sort of roll their eyes. I mean, AI, this is nothing new for us.
Yeah,
It's a new age of it, and it's shinier than it used to be. But with everybody else, I mean, this is still. I don't know about in your practice. It sounds like you're using it. You're pretty far advanced. But as you start getting into some of these Marcus Welbys that have been involved, the older, the generational aspects of this, I
yep,
mean, there is a training part of it, and the training is obviously related to how and where you use it to the extent that it's not going to do harm, which is
yep.
one of the problems with innovation in medicine is, as I've seen it, it's a do no harm business. And innovation and do no harm don't live very well together when there's risk involved. So how are you seeing in your practice and especially in your consulting business, how are people being trained on this, especially in areas when it gets generative where it's prompt engineering, where you not only have to know what AI is, but you have to know how to structure questions over and over again and refine the questions to get the answers from sometimes a not so friendly algorithm because they get pissed off.
Yeah, I think like certainly getting generative AI blowback from your model. Yeah,
Right.
that's like just like the next level of workplace stress. No, I think that the key aspects here, first of all, are you really hit on that, is that um, the outputs are variable. Like I think all of us are used to interacting with technology in a very like outcome driven way. I hit a
Mhm.
button, I get a predictable response. And
Mhm.
so I think that's one of the key things is the mindset around deploying these systems for to your end users
Mhm.
is understanding that the outputs are variable. Like you don't know, you need to question the outputs of the system. Number one, when you said prompting, absolutely. If you want a specific output, you have to provide it with very specific information um, in order to get the desired output. And this is where I think the relational aspect. I think if we frame it in terms of more like you're actually having a conversation with like a resource, like with another person that you need to extract information from. I think I found that is the best way to frame it, because that's
Mhm.
actually what's happening in these scenarios. Like you're actually having much more of a dialogue to get to a certain endpoint. And I think that having the relationship mindset rather than a point and click mindset that really helps people wrap their head around. It's like, oh, I got to be a little bit more engaged. I got to do some active listening to the outputs that are provided, and I gotta refine it a little bit more
Mhm.
to make sure that ultimately I'm getting the information that I need from the system. And I think that's the biggest leap there. And so then so you have to think about, now I got to scale this mindset across my enterprise.
There you go.
Right? I have to scale that mindset across my enterprise. And that's the hard part. I think ultimately it's going to be about scalability. How can you scale AI across your enterprise?
So you walk the halls of health, and booth to booth, everyone had AI in some way, shape, or form. I wrote an article about AI washing. You can't have it. It's like zero trust in cybersecurity. You can't even have a brochure without it saying zero trust in some way, shape, or form. Well, but you just never know. They probably do have it, but it might just be something related to ChatGPT. So they do have it, but it's it's not really street cred. How would you describe? What advice would you give to the vendors that might be listening to us today about how they could do better at going to market with this? And you mentioned, I'm going to lead the witness a little bit.
Yeah.
You mentioned that this is just like, it's an endpoint solution as opposed to a systemic solution.
Mm-hmm.
So how do you get in between that? Because I think a lot of them are endpoint, that you could use it for this, just like it's endpoint for me right now. I could look you up on ChatGPT, and this is surely not systemic. What advice do you give vendors out there?
So the key with vendors is you have to understand who is buying your product, right? And so what is really important to them. And a lot of times, yes, they want the upside, but there's a lot of young companies out there with a lot of younger founders that don't quite understand the stakes involved in healthcare. And so the advice that I really give to them first is get a clinical expert on your team yesterday, right? I think that's one of the key things. Number one, get someone that understands the workflow that you're trying to address, because no one really cares that the button you're clicking works or that the prompt you're putting in produces like this output. What they really care about, does it fit in the right place in the clinical workflow? Like, what is the context? Number one. Number two, you got to show the enterprise that you're taking security seriously, that you're taking privacy and security seriously, because I think you've probably seen this, and this was notably absent from health, the discussions around cybersecurity, even though that costs people a ton of money this year.
Oh, yeah.
And that you're taking security and privacy seriously, and that you have legitimate answers for how you're going to manage and where you're going to store the data that's coming in from the enterprise. And I think that's where you need to be really savvy around that and show that you're clearly thinking about that. So those are the two big things: clinical expertise mixed with a real emphasis on privacy and security, and probably a little bit also of just understanding, does this even fit in with the strategic priorities of the enterprise itself, right? Are you actually targeting a valuable use case? And that's where I think the clinical enterprise value stack that I talk about comes in. Is like, it's great that you focus on something clinical. You got to have it create value for the enterprise at the end of the day.
Thank you for being here on Health Stealth Radio, and thank you for joining us on Healthcare Now Radio Syndicate, and we hope to see you again next week.
Thank you so much, Frank. It's an absolute pleasure, honor to be on your show and chat with you.
Thank you for joining us today in the shadows for this episode of Health Stealth Radio with Frank Cutitta. If you like the program, please be sure to share your comments on our social media sites, or feel free to contact us with suggestions for new and stealthy show themes. We look forward to welcoming you again for our next broadcast. In the meantime, stay safe out there.